Hey guys, Dr. Mike here. Have you ever dealt with that nagging knee pain that just won't quit? You're not alone. Millions of people struggle with knee pain every single day. What if I told you that 60% of knee pain has nothing to do with your knee? You heard that right. The root cause could be hiding somewhere else entirely, and today we're diving deep into the 15 shocking causes doctors often miss. We'll uncover the hidden culprits and give you actionable steps to find relief. Fast! Stay tuned because we're going to meet Sarah Thompson, who suffered from debilitating knee pain for years. Doctors couldn't figure it out, but then she discovered the real reason, and it changed everything. Let's talk about Sarah. Sarah, like many of you, loved to stay active, but her knee pain was so bad she could barely walk some days. She went through countless doctor's appointments, x-rays, MRIs, you name it. They all pointed to the knee, but nothing seemed to help long-term. Sarah eventually discovered that her knee pain wasn't originating in her knee at all. It was all stemming from a misalignment in her hip. You see, our bodies are interconnected. When one part is out of whack, it can throw everything off balance. Think of it like a car. If your wheels are misaligned, it's going to affect your steering, your tire wear, and even your suspension. Your body works the same way. A misaligned hip can put extra stress on your knee joint, leading to pain, inflammation, and even long-term damage. The good news is that hip misalignment is treatable. We'll talk more about specific exercises and stretches you can do to realign your hips and finally get rid of that stubborn knee pain. Now let's talk about another sneaky culprit: nerve compression. You might be thinking, wait, nerves? But my knee pain feels like it's in my bones. But here's the thing, nerves send signals throughout your entire body, including pain signals. Sometimes a nerve can become compressed or irritated, and that pain can radiate down your leg and manifest as knee pain. This is especially common with a condition called sciatica, where the sciatic nerve, which runs from your lower back down your leg, gets pinched. We'll discuss some simple stretches and exercises you can do to relieve nerve pressure and get back to feeling your best. Okay, this next one might surprise you. Did you know that a simple vitamin deficiency could be contributing to your knee pain? Specifically, we're talking about vitamin D. Vitamin D is crucial for bone health because it helps your body absorb calcium. Studies have shown that people with low vitamin D levels are more likely to experience joint pain, including knee pain. The good news is that addressing a vitamin D deficiency is relatively simple. You can increase your intake through certain foods like fatty fish, eggs, and fortified milk. Chapter 4. Could it be this? The autoimmune link to knee pain. In an autoimmune disorder, your immune system, which is designed to protect your body from invaders like viruses and bacteria, mistakenly attacks your own healthy tissues. And guess what? Your joints, including your knees, can be a target for these autoimmune attacks. Conditions like rheumatoid arthritis, lupus, and psoriatic arthritis can all cause significant joint pain and inflammation. Early diagnosis and treatment are crucial for managing these conditions and preventing further joint damage. Chapter 5. Arthritis pain. This 30-second ice trick works wonders. Let's face it, arthritis is a common culprit behind knee pain, especially as we age. But don't worry, it doesn't mean you have to resign yourself to a life of pain. There are simple yet effective things you can do at home to find relief. And one of my favorites is the 30-second ice trick. Apply an ice pack or a bag of frozen peas wrapped in a thin towel directly to your knee for 30 seconds. Then remove it for 30 seconds. Repeat this on and off cycle for a total of 10 to 15 minutes. The cold from the ice helps to numb the area, reducing pain signals and inflammation. Chapter 6. Ligament tears. Master the RICE protocol in 60 seconds. Ligament tears are a common sports injury, but they can happen to anyone, especially after a fall or sudden twist. If you suspect a ligament tear, it's crucial to see a doctor for proper diagnosis and treatment. In the meantime, you can follow the RICE protocol, which stands for rest, ice, compression, and elevation. Rest. Avoid putting weight on the injured knee. Ice. Apply ice for 20 minutes at a time, several times a day. Compression. Use a compression bandage to reduce swelling. Chapter 7. Meniscus tears, the quad squeeze that could save your knee. The meniscus is a C-shaped cartilage that acts as a shock absorber in your knee joint. Like ligaments, the meniscus can tear, causing pain, swelling, and difficulty moving your knee. While you should always consult a doctor for a suspected meniscus tear, a simple exercise called the quad squeeze can help strengthen the muscles around your knee and provide support. Lie on your back with your injured leg straight, place a rolled-up towel under your knee, tighten your thigh muscles and push your knee down into the towel. Hold for 5 seconds, then relax. Repeat 10 to 15 times. Chapter 8, Bursitis Pain. The elevation secret you need to know. Bursitis is the inflammation of the bursae, small fluid-filled sacs that cushion your joints. When these sacs become irritated, they can cause pain and swelling. One of the simplest yet most effective ways to manage bursitis pain is elevation. By elevating your knee above your heart, you're helping to reduce inflammation and promote fluid drainage. Try propping your leg up on pillows while you're watching TV or reading a book. Chapter 9, the 60% shocker, how your hip could be causing knee pain. Remember Sarah's story? Her knee pain was actually caused by hip misalignment. Studies have shown that up to 60% of chronic knee pain originates in the hip. The hip and knee joints are intricately connected, and problems in one area can easily affect the other. If you've been struggling with knee pain and haven't found relief through traditional treatments, it's worth considering whether your hip might be the root cause. We'll discuss specific exercises and stretches you can do to improve hip mobility and alignment, which can, in turn, alleviate your knee pain. Chapter 10. That burning sensation could be a pinched nerve 6 inches away. We talked earlier about how nerve compression can cause knee pain, even if the source of the problem is far from your knee. One of the most common culprits is a pinched nerve in your lower back. The sciatic nerve, which runs from your lower back down your leg, can become compressed or irritated, sending shooting pain down your leg that can radiate to your knee. We'll show you some of these exercises later in the video. Chapter 11. This will shock you, how your shoes could be wrecking your knees. You might be surprised to learn that your footwear could be a major contributor to your knee pain. Wearing shoes that don't provide adequate support or that have worn-down soles can put extra stress on your knees, leading to pain and inflammation. High heels, for example, can shift your weight forward, putting excessive pressure on your knees. The solution? Invest in supportive shoes that fit well and provide good arch support. Look for shoes with cushioned soles and a slight heel-to-toe drop. Chapter 12. The silent epidemic, how vitamin D deficiency affects your knees. We touched on this earlier, but it's worth repeating. Vitamin D deficiency is incredibly common, and it can have a significant impact on your joint health, including your knees. Vitamin D helps your body absorb calcium, which is essential for strong bones. When you're deficient in vitamin D, your bones can become weak and brittle, making them more susceptible to injury and pain. Talk to your doctor about getting your levels checked and discuss whether supplementation is right for you. Chapter 13. Osgood-Schlatter disease. The growing pains nobody talks about. Osgood-Schlatter disease is a common condition that affects children and adolescents, particularly those who are active in sports. It's characterized by pain and swelling below the kneecap, where a tendon attaches to the shin bone. While it can be painful, Osgood-Schlatter disease is usually self-limiting and resolves on its own with rest and over-the-counter pain relievers. Chapter 14. IT band syndrome. The foam rolling technique that actually works. The iliotibial or IT band is a thick band of tissue that runs along the outside of your thigh from your hip to your knee. IT band syndrome occurs when this band becomes tight or inflamed, causing pain on the outside of your knee. Foam rolling is a great way to release tightness in the IT band and alleviate pain. Chapter 15. Osteonecrosis, the silent destroyer with early warning signs. Osteonecrosis, also known as avascular necrosis, is a serious condition that occurs when blood flow to a bone is disrupted, leading to bone death. The hip is the most common joint affected by osteonecrosis, but it can also occur in the knee. Early diagnosis and treatment of osteonecrosis are crucial for preventing further bone damage. Auto take control of your knee health. Wow, we've covered a lot of ground today. We've talked about everything from hip misalignment to vitamin deficiencies to the importance of proper footwear. The key takeaway here is that knee pain is complex, and it's often caused by factors that go beyond the knee itself. Ready to solve your knee pain mystery? Download our free knee pain checklist, link below. This checklist will walk you through the most common causes we discussed today and help you pinpoint what might be going on in your body. Hit that like if your mind is blown, and subscribe for more life-changing health secrets. Coming next week, the 3-minute knee fix that replaced surgery. You won't want to miss it.